so today we're going to perform a Microfilaria heartworm direct smear. So I'll go ahead and go over the supplies that we need here. So we have our whole fresh EDTA blood. We're going to invert just a few times to make sure it's correctly mixed. Okay, we have our microscope slide. We have a microscope slide cover slips, and then we have transfer pipette. So what we're going to do, I'll kind of zoom in so you can see a little bit better. So what we're going to do is we're going to take a single drop of our blood here using our transfer pipette, and we're going to put a single drop of blood on our slide. Set that aside. Set our blood aside. The next thing we're going to do is we're going to very carefully take a cover slip and we're going to place it on the top of our drop of blood on our slide, just like so. So the end result should look something just like that. So the next thing we'll do is we'll look at it underneath the microscope and we'll try to identify any microfilaria that may be on this slide. This is just to verify that we're filming on our OCCI approved clinical site. This is Chuckanut Valley Veterinary Clinic. Today we're doing our microscope work in the exam room. Okay, so for today we're going to go ahead and read our direct smear underneath the microscope for our Microfilaria direct smear. So we're looking for any signs of heartworm here on our smear. So the first thing you want to do is you want to make sure that you take your labeled slide. So this has our patient name and the date. You want to go ahead and put it underneath the microscope. You want to make sure you're on your lowest power objective here. We're going to start off on 4. Okay. Go ahead and turn on our microscope. And when you read cytology, you want to read in a systematic way. So I make a little illustration of how I like to read. So I basically start in the top left corner, and then I kind of go all the way down the slide. And then you go over, you go all the way back up, and then so you do that so that way you don't miss any parts of the microscope slide and you cover the entire thing. And you also do it in this kind of systematic way so that way you don't go over something that you've already gone over. Okay, so let's get started. So we're going to start in the top left corner of our slide. The first thing we're going to do is we're going to kind of just peek around and make sure that our condenser is where we want it, and just kind of get things in focus. Okay. And just even being on the lowest power, I can see lots and lots of red blood cells, little tiny red dots. We're going to go ahead and we're going to bump it up to the 10 power objective. Okay, and I can see even better, lots of red blood cells. So we'll go ahead and we'll start scanning on this objective. I'm just adjusting my focus here. Okay, and I'm going to bump it up to our 40 power objective. And we're going to look. Fixing the focus here. Okay, so I see lots and lots of red blood cells. So the things we're looking for, right now I'm on our 40 power objective. I'm looking for any signs of, usually microfilaria will be moving. They're very active, and they generally are fairly large in comparison to our red blood cells. So at the power that I'm at right now, I should see one. It should take up majority of the high power field that I'm looking at. So it's a fairly large object when you're comparing it to the red blood cells that it's usually surrounding it. And so we're going to do our systematic order. We're going to go all the way down the slide. We're going to move over slightly, and then we're going to go all the way back up. Just kind of adjusting the focus a little bit as we go. Lots and lots of red blood cells. Okay, we get to the edge of the slide, we move over one more row, and then we go back down. Okay, and move back up the slide. And so far, I'm just seeing lots and lots of red blood cells. And I'm still just seeing lots of red blood cells. They're kind of just floating around, moving around. I can see them kind of turning. Okay, and we're heading up our last row on our slide here. Okay. So now that we've looked at the entire thing, we're going to put it back at the lowest power objective again. We're going to turn our microscope off. We're going to take our slide gently out. We're going to set it aside. And the last thing we're going to do is we're going to record in our patient's chart here, which I have today, right? So this slide is for Grace. So for Grace today, I'm going to write Microfilaria direct smear negative. Negative for Microfilaria. Too numerous to count red blood cells, RBCs. The last thing we would do is we make sure our veterinarian double checks us and make sure that they don't see any signs of microfilaria as well. The last thing we're going to do is I'm going to go ahead and go over what microfilaria would look like if you did happen to see it underneath the microscope. Okay, so today we're going to discuss heartworm disease and what you're looking for. So unfortunately, our direct smear did not yield any signs of microfilaria. Well, unfortunately for us as far as seeing a cool example, but fortunate for the dog. So, but I will show you things to look for if you were to actually see a microfilaria on cytology. So the first thing I'll show you is just a photo. So we'll kind of go over what this is and what we're seeing here. So this worm-looking thing, you guessed it, this is our heartworm. This is a stained example of our heartworm. And as you can see, these guys, these little red things all around, this is red blood cells. So this is an example of a direct smear, and this would be a heartworm. Generally, you will see these guys moving like crazy. It always looks like they're dancing on your slide. Kind of an unpleasant sight to see. Kind of cool though. And I'll go ahead and show you a video also of what you'd be looking for as well. So we'll go ahead and we'll come on over here. Okay. Okay. And go ahead and check out our video here. So as you can see, this is our heartworm right here. He's moving like crazy. He's dancing around. That is kind of more typically what you'd expect to see. They're pretty active. Okay, so there are many products on the market right now that do prevent heartworm and treat for heartworm. Namely, the first two that come to mind are milbemycin and ivermectin. These are going to be in your more common preventatives such as Trifexis, HeartGuard, that kind of thing. If you did live in a heartworm prevalent area, it's recommended to be on it monthly to be current on it. So we live in Washington State. I live in Washington State here. It is not a huge thing here. However, we are starting to see cases of it here, so we are now recommending it.